I'm sitting. So the first thing I'm going to do is check the chart for any information. Then I'm going to grab my materials that I'll need for the activity I'm doing with the patient. Then I will put on PPE if indicated, and then I will perform hand hygiene. So then I'll come in. So knock, knock, knock.
Come in.
My name is Amanda. I'll be your nurse today.
Okay.
Can I identify with you? I'm not redoing this. Can I identify you with 2 identifiers, please?
Yeah.
What's your name? Why did I wait for you to respond?
Emily.
Date of birth?
10/26/97.
Okay, thank you. Then next. Sorry about that, guys. Next, I will explain what I'm doing. So I'm going to be listening to heart sounds and peripheral. So the first thing that I'm going to do is listen to her lung sounds. I'll explain as I go, so I'm not going to explain it now. Here we go. Can you lift up your shirt, please?
Sure.
Okay. Can you turn this way a little bit? Okay. The first one I'm listening to is the aortic. Okay, it's the second intercostal space on the right sternal border. And then I'm coming over and listening to the pulmonic, which is also the second intercostal but on the left sternal border. And then I'm coming down and listening to Erb's point, which is the third intercostal left sternal border. And then I'm listening to the tricuspid, which is the fifth intercostal space, and it's still the left sternal border. And then I'm coming over and listening to the mitral. And that's at the fifth intercostal space, but it's at the midclavicular line. So the next thing I'm going to note is that S1 and S2 were regular and normal, so her heart sounds were normal as well, no murmurs noted. So the next thing I'm going to do is feel for her jugular veins. So I'm going to come down here. Okay, and then I'm going to come to the other side. Don't do both at the same time or you'll make them pass out. Okay, I would say they're about 3+. So the next thing I'm going to do is go in and listen. I'm using the bell of my stethoscope, not my diaphragm. So I'm going in and listening at 3 different places, at the top, the middle, and the bottom. Can you hold your breath? Are you holding your breath? Are you lying? Okay. You can breathe if you need to. And hold it. Okay, I'm going to have you turn your head and listen to the other side. No abnormal sounds and no bruise noted. So the next thing I'm going to do is check her arms. So I'm looking for symmetry. So I'm going to have her hold her arms out and they're both symmetric, which is good. And as she's doing this, I'm looking for skin condition. I'm making sure their skin tone is even and right for their ethnicity. I'm checking for hair distribution to make sure it's even throughout both of her arms. I'm checking her temperature with the back of my hands. It's even. I'm also looking for any tenderness, any sores, any bruises, any of that sort of nature. The next thing I will do, you can put your arms down now. The next thing I'll do is go in and feel her pulse. So that's about a 4+, so bounding. And then I'm going to go in and look at her cap refill. It's about 2 seconds, which it needs to be 3, so that's good. Same thing, I'm looking for skin texture, which I did throughout when I was looking for symmetry. Okay, you're okay. I'm checking for edema as well, so I want to make sure that there's no water retention. I'm going to check her pulse. Okay, say that's a 4+ as well. Going in and checking her cap refill. About 2 seconds, so that's good. Then I'm going to go in and look at her feet. So I'm going to have you bring your feet out for me, and they can see it well, so that's good. I'm going to roll your pant leg up, okay? As much as it'll go. Okay, so I'm checking for hair distribution, making sure it's even, checking for edema, checking the temperature, checking the skin tone. Sorry, I had an eyelash. I'm making sure their skin tone is right for their ethnicity. I'm making sure there's no rashes, bruises, lesions, or anything of that nature. Again, I'm feeling for edema, making sure there's no water retention. Then I'm going to go in, feel her pulses. I would say that's about 2+, and then I'm going in, feeling her other pulse. And I would say that's 2+ as well. Then I'm checking her cap refill in her toenails. And it's about a 2, which is good. Then I'm going back in the other leg. You're welcome, no problem. Then I'm going over and checking hair distribution again, making sure it's even. I don't see much, but that's what happens when she shaves. So I'm going to feel temperature, feel for edema, look at the skin condition, make sure it's right for ethnicity. I would note that she has a vein on the bottom of her foot, and mind that because it's very sensitive. I'm going to go in and feel her pulse on this side, so I'm going to go this way. So I would say that's about a 2+ as well. Then I'm going to go in the back and feel that one as well. And that's 2+. So then I'm going to go in and look at cap refill. It's about 2 seconds as well. So then I'm going to make sure the patient is comfortable, make sure they don't need anything else, make sure their colli is in reach, make sure they're comfortable, their bed's at the lowest position they want it at. If they need any more pillows, if they need anything of that nature, then I'm going to take off PPE if I had it on, remove my gloves if I had those on, and wash my hands.